In this presentation, we're going to look real quick at some lab values that Ms. Carmack put together for us. As we're talking about these various disease processes, we're talking about what happens to red blood cells or hematocrit or hemoglobin, platelets, and other various lab values that you need to be familiar with. You've been exposed to quite a few of these starting this semester, and we want to add to that knowledge base. One of the big things to remember here, guys, is that this is not memorization type material. You actually need to know these. So we need to be committing these things to memory, thinking about how these values affect our patients and what they mean to us when we see them. We're going to look at our white blood cell counts first. For a person from 11 years of age to an adult, we're looking at counts of 45,000 to 11,000. You may see this expressed a couple of different ways. This number may be expressed simply 4.5 or 11.0. Whenever you see them without any unit of measure behind them, you need to multiply them by 1,000, and then you would have the mm cubed there behind the number if you multiplied it out. So don't let that surprise you looking at a lab report from a hospital, because they give you a white blood cell count of simply 4.5 or 11.0. Typically they don't seem to respect the trailing zeros on lab work rule, but know that that's out there. It's usually printed, and it's very easy to see that that's a decimal point and not simply a comma or a 1 or something that may be misinterpreted in a drug order. Red blood cells for an adult male, we're looking at 4.71 to 5.14. You also see the female at 5.20 to 4.87. Platelet counts, remember anything much below that 150,000 number, your patient's going to have difficulty forming clots. You may see this number also expressed as a decimal number, 0.9, 0.3, 1.2. Basically all the patients will be exhibiting low platelet counts. So just be cautious of that as you're looking at your patient's lab work and realizing how these units are measured or reported. As you continue to look at this, you see your hematocrit numbers for both males and females. Likewise, hemoglobin. Serum calcium, remember anytime you see serum, you know that's coming from the blood. And also some of our cancers that we look at right now, we have problems with increased serum calcium, and I'm sure the presentations on Monday will cover that. I've also included in this PowerPoint the CAUTION acronym for you to use again. Cancer that you've seen in the previous slides. This is one on leukemia that you may find beneficial. I've changed the middle block on this to reflect the values from Davis. One of the things that you'll find whenever you look at any lab is the hospital, clinic, or laboratory that's reporting the values will give you their lab's norms for that range. So if you look at the printing, for example, on the actual teeter-totter there, they're the ones that the memory notebook reported, but I went ahead and overwrote the ones in the center to reflect the Davis lab book, just so that you got that and are able to use that. Included one on Randy for bleeding precautions. He gives you some tips there that you need to be aware of, and again, he's warning you if that platelet count is below 150,000 that you may have some problems with clotting. This PowerPoint presentation will be posted under the classroom discussion for oncology over on the main classroom homepage on Blackboard. Feel free to print that one and download that one. This PowerPoint will be unloaded in its entirety.